Greetings. We're here with Dr. Jürgen Konczak as a follow-up to the webinar that we hosted on May 24th on vibrotactile stimulation to review some of the questions that we were not able to answer live. Thank you, Dr. Konczak, for being here and helping us answer some of these questions. We really appreciate it.
My pleasure.
We'll go ahead and get started with some of these. So some of the questions that we had were regarding, typically you have been using this treatment for spasmodic dysphonia, laryngeal dystonia, the abductor and the adductor. And so we did have some questions regarding whether or not this would work for some other issues. So is there any connection or a use for this with cervical dystonia that affects the neck?
Yes, and we have completed another clinical trial with some European partners and Canadian partners on actually looking at vibrotactile of stimulation of neck muscles, and so it's a little bit more difficult to do because there are more muscles involved, but I can tell you we have completed this. We have about 60 some people have done this, and yes, some people will benefit, and the benefits we see is in the righting of the head or the reduction of pain.
And how about if a person had multifocal dystonia? So if they had spasmodic dysphonia and cervical dystonia?
We haven't tested those yet because we always had this in our studies as exclusion criteria that you either have laryngeal dystonia or cervical dystonia and no mixed forms. In principle, it should work for mixed, but we do not have firm data on this yet.
Okay, perfect. And would this work on something somebody asked about? They had a surgical removal of polyps on the vocal cords. Do you think stimulation would help their condition at all?
I honestly don't know. Because what this stimulation does, I'm not sure whether it will penetrate deep enough to do something to literally the vocal cords itself. Certainly not if it's in the lower frequencies.
Okay, great. So during the webinar, you had mentioned that some patients had experienced a drop off in improvement at the 11-week mark. The question was a clarification. Did you mean it didn't continue to work as well, or that the improvement rate slowed, but the results were still sustained?
So what we saw, and I think for those who are receiving Botox will fully understand this, that let's assume a person has a Botox cycle, and many of the participants we had a Botox cycle of roughly around 3 months. So they would come right after they got their Botox, about within 2 weeks. So if they had any kind of mute phase, it would be gone. So we could test them. Then in the middle of their golden phase, so to speak, we saw them at around week 6 of their Botox cycle, and that's where their voice is better with or without VTS, no matter what. And what we saw is there is an added effect even in their golden, in their best period. Then the Botox cycle goes down, they become symptomatic again. So what we see is that some people actually then also drop down their performance. So the added effect may still be there, but their performance goes down. So that's what we observed. We also got some people saying, oh, it seems like that my Botox lasts longer. So we got these anecdotal reports, but again, we haven't done this systematically.
Okay. And so it may more be in conjunction if the person was having Botox, that the Botox effect is starting to wear off also. So kind of they're working simultaneously then.
Correct.
Okay. Do you think that there are going to be any long-term side effects utilizing this type of treatment?
We don't know. We don't know. Do I expect them? Honestly, I don't. But do we have those data? No, we do not have them. All what I can say is people who have used it roughly on the order of up to 3 months, we did not have any reports of adverse events.
Okay. And how often do you think somebody would be able to use VTS?
So in this one longitudinal study that we just completed, people literally only did it 1 time a week for 20 minutes or 3 times a week for 20 minutes. I think people may do it more often, meaning 5 times a week. So I think this is something that will depend on the effect on the individual patients, because one of the things that we see for some patients who are doing it, they see maybe a quick effect, but the effect may only last half an hour to an hour, 2 hours. And then if they do it again, it happens again. For the other people, it may last a day or 2 days, or even 3 days. So that, I think, will eventually determine what dosage a person would like to receive.
And at this point in the studies that you have done, what is the longest time frame somebody has used VTS?
8 weeks.
8 weeks. Okay, great. I think that helps to kind of put perspective that, you know, there needs to be more research done for long-term impact and everything. Do you think that this is something that a speech pathologist may be able to offer in the future?
In principle, yes. It could be that a speech pathologist has a unit or several units and offers this as service. Possible, yes.
Okay. And would massage therapy be an option to those who react positively to VTS as a sensory input?
I don't know. In
Yeah.
principle, yes, it's also some form of tactile stimulation. So it could work. One would have to see this. Now, there is something about the right amount of frequency of stimulation. That's a part we are working on right now. Are there optimal stimulation frequencies? And we have worked within a range of frequencies, but we don't have definitive data yet. So massage therapy, I can't exclude that it will not work. I am a bit skeptical to think that it will have exactly the same effect.
Okay. And what do you think, what are your next steps with this project?
So, I mean, we are at a stage now where we have longitudinal data, as I said, for people who have gone through this clinical trial for 11 weeks. So we have some longitudinal data. What we now need is, I think we need more usability data. People using it, even if we don't get these very precise objective data, even if we don't get brain data like EEG, what we have done, but simply having a group of people now trying it out, have their subjective ratings, their subjective impressions. That is our next step, and just to enlarge the sample of people who have used it, and to get really a better handle on usability as well as on effectiveness.
And so if people are interested in participating, what is the best way to go about this?
So what we will try to do now is we will set up a simple form on our website where people can go to, on our laboratory website. People can basically indicate their interest in participating in receiving one of those units and trying it out at home. But as of right now, I want to say it will be a limited amount of time. We are not at a point where we can just
Okay. And if somebody participates, because this is still a research study, would they have a limited time to try the unit out and then return it to you? Or how does that typically work?
I think that's what we will do initially. Yes, we will, because we only also have limited units available. I think it will be that you will have the opportunity to try it out for a limited time. And we have to think about, I'm thinking probably about 2 months, maybe 3 months, but then you will have to return it. And ideally, we get in that way many other people. We can send it out again to a next a group of people, and we get as many people as possible, get some exposure and get some data back from them on what worked for them and what did not.
And with the data collection, is there an app that they use, or is it an online form? How do they provide that feedback to you?
Yeah, we will likelihood is we will have to try whether we can do some kind of an online form. That would be the easiest one. But they will do some kind of subjective instrument where they have to rate their effects. And there are several ones out there. Some of them are validated, some of them are not validated. But that's what it will happen.
Okay. And you'll be offering this opportunity to people with both adductor spasmodic dysphonia and abductor spasmodic dysphonia?
Exactly. Because we know it can work potentially in both.
Excellent. Anything else that you'd want to share about people who are interested in participating in this kind of next phase, this more subjective phase?
I don't know what else. I think overall, I think this is an exciting time. And I think for us, it's really to enter a next step. And we are still in a research phase. We are still not in a phase where this is a commercial product that one can buy. But I hope that this next usability study that we're doing is another step in that direction, so that eventually this can be some form of therapeutic device that can be made available and could be commercially available, literally that people can buy it and clinics can offer it as a service.
Excellent. Well, we want to thank you so much for your dedication on this project. I know you've been working on this for a long time, and we're very proud as an organization to have helped fund some of the initial studies, especially with abductor dysphonia, and just really giving people hope and an opportunity for some kind of external treatment to help reduce the symptoms of these voice conditions.
Yeah, thank you. We will push as best as we can to make this a reality for all of you.